Is he gonna show the credits for us?
He's supposed to.
'Cause I got the timer set at 28 minutes.
I know.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power
Come on,
in
Paul.
our union.
Ocean Spring. Okay. Hello, this is Elizabeth Mance from the April 4th Coalition Show. This is the March 15th, 2021 edition of the show. It is week 341 and the 278th show that we have done since the closing of the North Adams Regional Hospital. Our mission, the April 4th Coalition mission statement is: we are for workers' rights and collective bargaining rights and are against tax breaks for the rich and corporations who ship our jobs overseas. We support all the articles of the Universal Declaration of Human Rights, but as is the custom for the show, we are going to start with Article 23. Dick, you want 1 and 2?
Sure. Everyone has the right to work, the free choice of employment, the just and favorable conditions of work, and protection against unemployment.
Number 2.
Everyone
Uh,
without any discrimination has the right to equal pay for equal work.
Number 3, everyone who works has the right to just and favorable remuneration, ensuring for himself and his family an existence worthy of human dignity and supplemented, if necessary, by other means of social protection. Number 4, everyone has the right to form and join trade unions for the protection of his or her interests.
On
And
that topic, I have the Berkshire Eagle here from
Mhm.
March 9th, where it says workers seeking unionization at Mass MoCA.
we've been hoping they'd try that for a long time.
So we hope that the workers vote, because they're seeking job security and salaries and other issues. And the management, just like President Biden, when he spoke to the Amazon company, saying the bosses should stay out of this. This is the workers' decision. They shouldn't interfere it, and they shouldn't mess with their universal human right to form and join a trade union. So we're behind you 100% down at Mass MoCA. So now we have a video, right? We're going to show.
Yeah, we have a video.
And I hope that we could somehow see it while it's being shown, but we're going to have to ask Paul to start it, and because it's about 22 minutes long, so we're going to get started right away. It's on single payer healthcare, and it's from the union perspective.
Is healthcare a big issue in negotiations? It's always a big issue for our union. You know, the cost of healthcare are going up considerably. It's becoming harder and harder to bargain with employers, especially when we want more money in, our members' wages. It's becoming difficult because more of that money is being spent towards healthcare costs.
When our union goes into bargaining, it's the number one priority. It's the number one issue that takes up negotiations. If we could have healthcare off the table, if we had a single payer system of healthcare, that wouldn't even become an issue anymore. more money would go back to the employer, more money would go back in the pockets of the members. So the real solution when it comes to contract negotiations is not to negotiate healthcare benefits. It's to have a single-payer system of healthcare, Medicare for all. Then it's off the table. Then everybody in this country has healthcare, whether you're a worker, whether you're union or not.
What's going on here at ATI?
Well, we are here on locked out. We've been locked out since the 15th of August. Healthcare is an issue. We've had great healthcare here for years, and I don't think any of us are naive enough to believe that we're not going to have to pay something. But the sweeping changes that they want to bring in, they're just completely off the charts. Yeah, they gave us a basic outline of the monthly premiums that we were going to have to pay, and they're increasing exponentially through the length of the contract that they've proposed.
I would venture to say that healthcare negotiations take up close to 50% of the negotiation now. Negotiation time, the economic outcome, and everything. In the collective bargaining situation, you end up having to make this choice between, do I get to have some improvement in wages, or do I spend everything on healthcare? And what am I going to get for everything I spend on healthcare?
The real problem with healthcare is that unions will typically negotiate 3-4-year contracts. It's really hard to predict how much health care is going to cost in any year. So we wind up spending a lot of time in negotiations arguing about how much of an increase the health care is going to cost the employer and hence our members.
We all expire November 30th. We lose our health care. We've received notices to that, and we have a basic emergency health care plan through the union. And I have 3 kids at home, all under the age of 16, and we will probably have to enroll those kids in CHIP.
One of the tragedies is that in America, when you're on strike or locked out or you're fighting for a better tomorrow, your health care is at risk. Healthcare negotiations are very, very complex nowadays. In fact, in our case, every round of negotiations, that's the fundamental issue that we struggle with right till the midnight deadline, or right till the deadline of getting an agreement or not.
We're here today in Dorchester, Massachusetts, right off of a 7-week strike with Verizon, and we're back to work and back at it. It seems like every contract, every 3 years, we have a battle over one thing or another, and primarily the healthcare issue. Healthcare is probably the better half of what they negotiate around as far as talks go. 1989 strike was all about healthcare. We had fought for 4 months to fight off that sharing the cost of healthcare and those terms that we hear so often, putting skin in the game, as a way of offsetting this out of control cost increases of health insurance. Didn't work then. It's not working now. So, we were back at it in 2016. Well, we went on strike April 13th, and our benefits would be terminated at the end of April 30th. So beginning May 1st, we were uninsured. You don't walk out with 40,000 people on the street on a whim. You're not simply exposed to the economic hardship of a strike, but quite honestly, your family and your savings and your everything is at stake.
If healthcare is tied to your job, it's better than nothing, but as it's an economic disadvantage. In fact, healthcare should not be tied to your job. You lose your job, you lose your healthcare. I mean, how irrational is that?
And that's a big problem. That's a big fear. And that's a big weapon that employers have in convincing workers to take less at the bargaining table.
One of the big challenges that unions are having in the United States today is bargaining and the demand for givebacks. almost every employer is asking for givebacks or tiers so that employees who come to work now for that company will not be eligible for the same benefits that workers who have been there for the past 10 years or 5 years. And creating that tiered system is divisive and it's deliberate. It's to have the older workers and the younger workers pitted against each other, the pensioners pitted against each other. So they're looking to take away benefits from pensioners because the people who are working now don't feel that pain. It's all about divide and conquer.
The cruelty in our system is that access to care comes through an employer, and then it may in turn come through a spouse or your parents. And that employer, then there's a probationary period before you're eligible for the benefits. There's annual health questionnaire. There's all kinds of social control, which is a nice way of saying messing with you, you know? Oh, do you really need to go to the doctor today? Can you get me a note from the doctor? Oh, what really happened? You know, we're gonna have to fill out all this paperwork. All of this control over all of us on the job that the employer actually has.
We have people who stay in jobs in this country because they hate their jobs, they hate their boss, or hate their working conditions, but they are worried about losing their health care benefits.
We don't have anything that's portable right now in this country, and that's part of the problem, part of the crisis.
Workers, when they go out on strike in an employer-based system, the first day of the strike, they lose their health insurance typically and have to find a way to replace that.
And what does that mean for your whole family? And what does that kind of insecurity mean for all of us? And so if you flip it over, you begin to see that if everyone had access to all the care they needed, we would have a moment of liberation.
GE just recently closed a facility in Milwaukee and announced that it was building a new facility in Canada. And obviously, Mr. Immelt and the other corporate fathers at GE are taking advantage of the fact that other countries like Canada have single-payer health insurance, and they don't have to provide employees with health insurance. So, in reality, the lack of a single-payer system in the U.S. makes our jobs here less secure.
In 2002, the Canadian Auto Workers Union, together with the Big Three automakers' Canadian units, issued a joint letter calling Canada's healthcare system a strategic advantage for Canada and an important ingredient in the auto industry's performance that allows significant total labor cost savings.
We know from Canada just across the border that people don't worry whether the care will be there, how they'll pay for it, what the copays will be, how they'll register for care. We know that it works right next door.
Well, it's pretty simple. Canada has universal health care, and the way health care works in Canada is that there's a floor, which you cannot fall below, but there's no ceiling. And when you withdraw your labor, whether it's a strike or whether you're locked out, where you're going to get your health care is never an issue. You're still in the national health care system.
I'm Chris Levitt. I'm with USW Local 13173. We're in Port Hope, Ontario, and this is the Cameco Conversion Facility. Well, we have a thing in Ontario called the OHIP, which is the Ontario Health Insurance Plan.
What is that?
It's a health care plan provided for all citizens that qualify. There is a certain amount of qualifications there about living so long in Ontario, but it's basically provided by the government of Ontario for the residents, and it's funded by both the residents as well as companies and businesses.
We have a minimum level of health care that we are privileged to have, and it helps with our bargaining because we don't have to bargain as much in as many details, I suspect.
I haven't spoken to anybody. The bit that I know of the American healthcare is just kind of what I've read on the internet.
Sucks.
I want to hear what it is.
Oh, copays, it's where it could be between the employee and the employer of how much money each side is paying in a percentage of a monetary amount.
Copays. You just described copays.
What do you think of a system like that?
I can see how it would definitely lead to people not getting the preventative treatment they require or being ahead of a disease or illness, because if you need to come up with that money and maybe you're off work for the disease reason, how do you get that together to treat yourself to do better?
Out of network I don't know what that means at all.
Out of network. I can guess on this one, but I'm not too sure. I'm assuming there's maybe a range for where you have your treatment, depending on your healthcare provider.
I'm not sure what that means.
What is it, though?
Out of network? I have no idea.
Denial of care. That doesn't happen here that I'm aware of. People get the health care. You go to the hospital, you get the health care. They treat you equally.
Denial of care. I've never run into that. I don't even know what to say about that.
Deductibles, it's another form of copay in a roundabout way. It also sucks.
Pre-existing condition. I know that is very important in the world of being injured at work. It doesn't hinder our health care here. We still get treated whether I have pre-existing condition or not.
Canada, there are no expenses. There are no out-of-pocket expenses. So in the United States, even if you're having Medicare, you have to choose between a variety of lettered plans, whether you are having a certain level of benefits that will be covered by your Medicare, and that will determine how much your Part B premium is. Very complicated. Canadians, you're just covered. You can see who you want, when you need, and get the care you need without having to pay anyone or having any premium.
When I go to the doctor, I give them my health card, which is my Ontario OHIP card. They check that I am who I am, and I see my doctor, and there's no paperwork.
The term Medicare was actually, the Canadians had it first, and Lyndon Johnson actually borrowed the term Medicare when he was creating a plan for elderly people in the United States. So they're the same in name only. In Canada, there's infinite choice, and in the United States, there's very limited choice.
I pick up the phone and make an appointment, and I show up, and there's no money out of pocket. There's no co-pays, and there's no deductibles. I just go visit my doctor, have my appointment, and leave.
Personally, I'm just glad to have the benefits, and I really feel for anybody that couldn't afford them down in the States.
These are hard line decisions that are made. The company makes a great argument that the costs are out of control, that they can't handle this, and that, that's their argument and their fight, and ours is, let's get some real solutions.
So HR 676 is a piece of legislation that has a number of congressional sponsors but has never come to the floor. HR 676 gets us there. HR 676 is an opportunity to have improved Medicare for all.
It's a blueprint for a public plan, a public national health program that's very, very workable. But not only is it workable, it's very, very comprehensible. It's easy to digest. The bill is less than 30 pages. It's something that many union members who I've known and worked with actually learned about the idea of single payer by simply looking online about what this bill has in it, reading the bill for themselves and saying, wow, I could really understand how that would work. Obviously, under a single payer system, we would not get our health care through our employer at all. The unions would then return to bargaining over wages and working conditions. Healthcare would be completely off the bargaining table.
I guess I'm one of the lucky ones because, I'm in a union and I have an employer and they negotiate health care. So I get to, go to the doctor when I'm sick. But even when you do that sometimes, you can have something that, may take time for to get approval. The doctors and the actual people who provide the care, they're impeded by the insurance company themselves. The insurance companies, they're not there to provide health care. They're there to make a profit. They're there to make money. Let's not get it mixed up.
If you look at the skyline of any city in the United States, you will see the huge buildings with the names of the insurance companies, and that's coming from the profit that should be going to the bedside of patients who need it.
HR 676 has some very key proposals. For example, access for all, the idea of everybody in, nobody out. All individuals residing within the United States and any territory of the United States would be covered without exception. No one would be excluded. In turn, every provider would also be in the system. That means that every patient would be free to choose any provider, any hospital, any clinic. When there's one system, there's freedom of choice. HR 676 outlines comprehensive benefits Everything a plan that you now have would be covered, plus long-term care, prescription drugs, mental health services, dental services, basic vision care and vision correction, hearing services, podiatric care. And there will be no user fees. In other words, no copays, no deductibles, no co-insurance. All delivery of necessary care would be free at the point of service, and there really should be no user fees, by the way. Studies have shown that people avoid necessary care if payment is needed at the time of service. A single payer means a single risk pool, the key efficiency of single payer. Currently, private health insurers have many risk pools, and they compete by cherry picking, looking for the risk pool that's the most lucrative and the most healthy. Placing all Americans into one risk pool would give us the most efficiency, and the cost of care for those that need it would then be spread across those who are healthy. All for-profit healthcare companies would be phased out for the services covered by the law. The insurance companies now operating would be replaced by a single payer, a national health program, like the current Medicare system, which has been in place since 1965. H.R. 676 would remove profiteering, lower administrative costs, and unlike current practice, a single payer would have the power to bargain with the drug makers. The savings, estimated at over $500 billion annually, would be put toward patients instead. H.R. 676 outlines a system of progressive financing to pay for everything. It starts with existing sources of federal government revenues for healthcare, increasing personal income taxes on the top 5% income earners, roughly those earning more than $180,000 each year, instituting a modest and progressive excise tax on payroll and self-employment income, instituting a modest tax on unearned income, income from investments rather than from work, and instituting a small tax on stock and bond transactions. Under a single payer, most Americans would pay less overall than they currently pay. In return, they would receive more coverage that would be their right from cradle to grave.
You get the insurance company out of the way, the middleman, it simplifies it, and you have direct contact with your doctor, and they're going to be able to save money. The cost is going to be reduced because of that. And if I have an issue, my doctor says, okay, you need to do that, you don't have to get approved by the insurance company. You go get it done. You don't have to worry about copays. You don't have to worry about deductibles. You don't have to worry about being approved by the insurance company. It's the solution.
So HR 676 is a very simple way for us to get to Canadian Medicare. And I like to describe it the way I often talk to the public about what we demand. They say the whole issue of healthcare is so complicated. I say it's very simple. It's everybody in and nobody out. HR 676 allows us to cover everyone. You're automatically enrolled. You're automatically entitled to the healthcare benefits that you need without having to pay premiums, without having to choose which company is going to administer the plan.
And so if we could enact this change, we would be stronger in every way. We'd be stronger at the bargaining table, we'd be stronger in our communities, and we would probably also be economically stronger as well. Because if you think about the poor communities, I grew up in a rural county in upstate New York that has no hospital. Think about what it would mean if everyone in that county suddenly had access to health care. Well, it would mean for the hospital that's about to be built that every future patient's going to be a paying customer. It would make it economically viable. So this would be an engine for us. It would be great for the union movement, therefore, just from the jobs point of view, of building a higher standard of living for all of us.
I think that there should be a bigger, broader struggle on the part of labor, organized labor, to help unorganized people get that kind of healthcare system in place.
Current climate is ripe for people to finally effect the change that we want to have. You just have, people have to get angry enough. This is going to be a demand by the people who are going to be in the streets demanding it.
Well, it's critical. The labor support for single payer is critical.
The solution to our healthcare crisis is H.R. 676, expand and improve Medicare for all. Unfortunately, what we have is a for-profit system, and the money interests are, they're very powerful. But nothing's more powerful than people. Nothing's more powerful than the rank and file members rising up and fighting for this.
The only way that we ever achieve or ever win on any issue of social justice in the United States has been with the support of unions. So I think it will be with physicians, nurses, and union members standing side by side that we will get HR 676 legislation to the floor, voted on for an up or down vote. I believe that the American public would endorse this and be supportive of it. But the only way that we are successful is when we have the union standing by our side.
Grassroots local movements are what make the change. And, you know, when members start doing that, start acting in solidarity, that's when the change is going to come.
And I have lived through a number of battles and know how important it is. It were union members who stand up and supported us for civil rights. It were union members who said it was time to make change in this country, and it will be union members who will lead us to success in terms of achieving an improved Medicare for all.
Okay,
Why
ready?
don't we just,
All right.
yeah,
Well, I hope everybody enjoyed the video. It's on a hot topic, universal health care, which anybody in the union knows is desperately needed. Just judging by my
It-
health plan.
yeah.
There's,
It would just free,
go ahead, Dick.
go ahead. No, it would free up people too, that they wouldn't be tied to a job just because they have good health care. Or if they, like they talked about, if they go on strike or get locked out, you don't lose your health care. The unions have a little bit more power.
Mhm.
And the other thing is that there
It's
won't
actually
be
good for
pockets of,
business.
right, there won't be pockets of uninsured people where hospitals have to close because they're not getting enough income. Everybody will be in. And so they'll be paying customers wherever they're human beings, not
Yep.
just where they're rich people or
Yep.
people who are middle class. Poor people
Correct.
will be paying customers and they'll be needing hospitals in every region. They could reopen our hospital as a full service hospital.
I agree.
So,
I agree. Definitely, it has all the benefits, but you got a big lobby out to get you, and that's the insurance industry. They don't want to go.
everybody in, nobody out. That's all we want. Everybody in, nobody out. We take care of everybody. Even those people that hate universal health care, their children will benefit from it.
Yes,
Even if
they
they
will.
hate it. You know, everyone will get it. So, you know, we just have a minute left. So we want to reinforce, we wish the workers well that are unionizing at Mass MoCA. We hope other workers get organized. Wish Federal Express would get organized. You know, I wish
Yeah.
that, we need to unionize all over the country. And
I just have better paying jobs for all.
yeah, and raise the minimum wage and we
A lot
just-
to do in 3 short years.
yeah. So we just hope that we get the right to vote.
And that would be good.
Don't take away people's right to vote. So
Nope.
we'll say power to the people, and we wish Mike well and Rachel well.
Well,
Thank you, Paul. Glad to see you're back.
Yep.
And,
and hopefully we'll be back next week if my internet permits.
yeah, or you'll be at the studio.
One or the other, yeah.
All right, take care now. Have a good night, everyone.
Take care.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together